Well, hello, everyone. Welcome to today's webinar, New Tools to Support Workforce Planning. I'm Melissa Seaver. I'm a senior advisor with Public Health Systems and Services at PHAB, and I will be one of the presenters for today's webinar. And I have two co-presenters joining me who I will introduce in just a moment. But first, we want to cover just a few logistical items. So first, due to the large number of participants, your microphones are muted, but you can use the chat to ask questions and to interact with us as presenters and also each other as fellow participants. So please feel free to do that throughout the webinar. We also want to note that the webinar will be recorded and shared as well. We'll share the link via email after the webinar, and it may be posted on our websites as well. And then lastly, want to just let you know that closed captioning is available within Zoom should you wish to turn that setting on. And so to enable it, just click on the closed caption button in the meeting toolbar. It's likely on the bottom of your screen. If you don't see it there, you can click on that little more circle with the three dots, and it should show up for you. But if you just click on that CC button, your closed captioning should be enabled. And then if you want to turn it off for any reason, you just click the button again and it should turn off. If you encounter any tech issues during the webinar, just pop a message into the chat, and hopefully one of our staff will be able to provide some support. All right, without further ado, I would love to introduce my co-presenters today. We have AC Rothenbucher. She is the Director of Workforce at the Association of State and Territorial Health Officials, or ASTHO. And also with us today is Colleen Swoboda. She is with the University of Nebraska Medical Center, College of Public Health, Office of Public Health Practice. So pleased to have both AC and Colleen with us today. And I'll let them say a little bit more about themselves and their organizations as we get a little bit further into the webinar. So moving on to today's topics. Our goal today is to introduce all of you to 3 new tools to support strategic workforce planning in your agency. And so these tools are complementary to each other. They can be used independently or in combination. So we'll start by setting the stage and just giving a little bit of context before we present the tools. And then my co-presenter and I will then provide an overview of the 3 new tools, and we'll leave a little time at the end for some open Q&A. So please, throughout the webinar, if you have questions, pop it in the chat. As presenters, we may respond to you in the chat, but we'll definitely leave some time at the end to address any unanswered questions. And then at the very end, we'll have a list of resources, and we'll leave a little bit of time to complete a short evaluation. Before we jump into content, just real quickly, I want to share a little bit about how we got here today, and just really note the collaborative nature of the work and also the tools. So AC, Colleen, and I, as well as our respective organizations, support FIG technical assistance efforts nationally. PHAB and ASTHO are national component B TA providers. We're funded directly by the CDC. And then the University of Nebraska Medical Center, College of Public Health, Office of Practice is a subcontractor through the 3rd national Comp B partner, NNPHI, and the Region 7 hub. And so we just happened to discover through our national TA provider meetings that we hold regularly, and just some mutual connections, that we were each working on some workforce planning related supports, and discovered that they were very complementary. And so while the tools we'll be sharing today were developed independently by each of our orgs, the work was coordinated just to ensure consistency and alignment for all of you as end users. So noting again, these resources can be used independently or in conjunction with one another, and you'll see that throughout our time together this afternoon. So with that, let's jump into content. And again, we want to begin with a level set and providing just some context for the resources that we'll be sharing today. So we'll start with touching on what is driving national public health workforce efforts. And you'll see on the slide, there have been a variety of reports on the future of public health that have been released in the last, say, 3 to 5 years, several of which, again, are shown on the slide. most of these, if not all, specifically noted the need or made a recommendation for strengthening the public health workforce, not only from a capacity perspective in terms of numbers, but also capability as well. So knowledge, skills, experience of the workforce. I also think it's important to note that many of these reports were released either right before or during the pandemic, which we know really further highlighted the needs in this space. Now, on a positive note, we've received historic federal funding through PHIG, the Public Health Infrastructure Grant, to support strengthening the public health workforce, as well as foundational capabilities and data modernization. PHIG specifically allocated over $3 billion to workforce efforts. And really, that's part of the reason why we're able to be here today. And we have the capacity and the resources to create tools like this to share with all of you who are doing workforce planning in your organizations. So that's a little bit about what's driving workforce efforts. Let's shift just real quickly and talk about workforce planning and what we mean when we talk about workforce planning. So what I'd love for you to do is in the chat, as you think about the term workforce planning, what words or phrases come to mind, and just pop that into the chat. And I'll take just a moment of pause and then I'll show the definition. We're seeing assessment, sustainability, retention, capacity and succession, equity, engagement. All good terms. That's great. Keep them coming. And I will reveal the definition here. This slide shows the definition for workforce planning that was created by ASTHO. And it really, in summary, is a strategic process that involves not only identifying current and future workforce needs, but then making a plan for how you intend to recruit, train, and retain that talent, and also build a healthy workplace culture as well, considering employee well-being. And so some of those items were noted in the chat. We do want to quickly note that sometimes you'll hear the term workforce development used interchangeably with workforce planning, and we want to make the distinction. We see a distinction, and we want to share that just real quickly. So when we talk about workforce planning, we're talking about the broad strategy development of plan, again, as defined on the slide. Workforce development is really the training component. So when someone says a workforce development plan, it's a plan designed to develop the knowledge, skills, and abilities of their workforce. So it really falls under that broader umbrella of workforce planning. But we sometimes see those two terms, workforce planning and workforce development planning, used interchangeably, but they're really not the same. And so we wanted to make that distinction before we jump into some of these tools. And then lastly, I want to just quickly note, before we turn to the tools, the connection to the PHAB standards and measures. And so for those of you that are familiar with the PHAB standards and measures for accreditation and reaccreditation, Domain 8 focuses entirely on building and supporting a diverse and skilled public health workforce. And so the associated standards and measures really take a broad strategic approach to workforce by defining those best practice standards related not only, again, to training and development, but also recruitment, retention, diversity, the supportive and work environment, employee well-being. Again, those items that you see in the definition, ASTHO's definition of workforce planning, and again, some of those terms that you all put into the chat. So again, we know that, by focusing on retention, recruitment, diversity, supportive work environments, employee well-being, that supports a healthy org culture, which we know then contributes to improved programs and services, which then ultimately contributes to improved community health outcomes. So with that little bit of context and level setting in mind, I'm going to turn it over to AC, who's going to talk about ASTHO's workforce planning guide. So AC, the floor is yours.
Thank you, Melissa. Happy to be here. Greetings, everyone. I'm AC Rothenbucher, as Melissa mentioned. Do you mind going back to the previous slide? Thanks, Melissa. I'm a director of workforce at ASTHO, Association of State and Territorial Health Officials. My background includes both state and local governmental public health, and I'm excited to be part of the ASTHO team, providing technical assistance and support to the amazing governmental public health staff across the country. So as Melissa mentioned, the workforce planning guide from ASTHO was really a collaborative effort between staff in ASTHO and multiple teams, as well as the workforce planning guide advisory team that advised us, which included representatives from local, state, and territorial governmental public health agencies who were interested in providing input, as well as national and state agencies with specific expertise in governmental public health workforce. Two of those experts included PHAB and University of Nebraska. And as you heard from Melissa, that really kind of led to this organic opportunity to align our tools and collaborate. So as such, the Workforce Planning Guide from ASTHO is really a high-level guidance document. We propose a cycle of workforce planning. You're going to see some templates, some tips, some links to resources within ASTHO as well as outside ASTHO, but it's not intended to be the full nitty-gritty. And that's the benefit of working together with our partners, is you're going to hear more from University of Nebraska and PHAB about how to even take this guide and the tools that we offer and drill down even deeper. So before we go into the workforce planning guide, I wanted to step back a little bit for those of you who may not be familiar. Who is ASTHO and how did we come to this role, and how did we come to developing this guide? ASTHO is the Association of State and Territorial Health Officials. We are a nonprofit organization that is committed to supporting the work of state and territorial public health officials and furthering the development and excellence of public health policy nationwide. We are a member-based organization, and our membership is comprised of chief health officials from states, Washington, D.C., the 5 U.S. territories, and 3 freely associated states. We support our peer communities through lots of peer networks and many support opportunities to our state and territorial health leaders, as well as senior executives and health departments who work with over 100,000 public health professionals employed at our state and territorial public health agencies across the country. Our primary functions are to develop strong and effective public health leaders, to improve public health through capacity building, technical assistance, and thought partnership, and advocate for resources and policies that improve the public's health and well-being. And in all of our endeavors, we aim to promote the advancement of equity and optimal health for all. And as Melissa mentioned, ASTHO is also one of the 3 FIG partners, NNPHI, PHAB, and ASTHO, collaborating to provide technical assistance and capacity building to the 107 funded state, territorial, and local public health jurisdictions through FIG, which is so exciting to have this support from the CDC and to really help you all who receive this funding further public health workforce and infrastructure efforts. And so out of a lot of TA requests, actually, from multiple agencies and through support from all of our partners, we had a lot of requests to get support on workforce planning, needs assessment, workforce assessment, training assessment. And we kind of stepped back and said, okay, this is the opportunity to not only provide that reactive TA support, but how can we develop a proactive product to help all jurisdictions, whether you're FIG funded, wherever you come from, on workforce planning. And so came to be the Workforce Planning Guide. So kind of as Melissa mentioned, when we think about workforce planning and what it means and why it's important, we at ASTHO believe that workforce planning is really an investment in individuals, in your workforce, and your agency. It's an opportunity to align action items and agency values across multiple areas. And many of you mentioned that in the chat earlier on. Recruitment, retention, succession and sustainability planning, professional development, training, and fostering a learning culture. And regardless of whether your agency is engaged in workforce planning as a requirement for a grant, like FIG, as PHAB accreditation requirement, or just as a best practice, it's really a great opportunity for your agency to step back, assess, strategize, and implement workforce initiatives that can lead to improved quality of services and systems, enhanced organizational performance, improved workplace culture, improved recruitment and retention rates, increased employee satisfaction, provide opportunities to receive a return on your investment and cost savings from decreasing your turnover. improving your capacity for your agency to address public health crises, and ideally improve your ability for your agency to adapt and change to what we know is a very changing public health landscape. So we have our workforce planning guide. So here's a screenshot of it. You can find it on ASTHO's website. It's also going to be linked in the slides later on in the presentation. And I think at some point here, we'll probably put it in the chat for you all to access. So the guide was written really for governmental public health agencies, whether you be from state, territory, freely associated state, or local jurisdiction. We do feel that even the guide could be applicable to other public health organizations, maybe it's tribal health centers or other public health agencies that are working on workforce planning. But it was initially developed for that with that governmental public health lens. As we mentioned, it's for agencies that are pursuing accreditation through PHAB and those that are not. It does align and speak to some of those PHAB standards, as Melissa mentioned, but it's not a requirement that you go through, be going through reaccreditation or accreditation to find benefit in the guide. And is also written, hopefully, such that wherever you are in your plan preparation, whether you've never done one, whether you're in the process of doing one, you've done one already. We hope you can find some helpful tips and templates and tools for your update of your next plan, the creation of the first one, or something to think about for your future. As I mentioned, it's a 5-phase cycle that we propose that I'll speak to next. And it has tools, templates, checklists that you can download that are fillable, and links to resources from within ASTHO as well as outside and our external partners. So you see here are 5 phases of workforce planning. We have organize, assess the environment, set priorities, develop the workforce plan, and then lastly, implement, track, review, and adapt. You can see it's set up as a cycle. It is intended to be iterative. So you can go back and forth between phases as you gain more information as your process progresses. The other thing to note is that when we thought about these phases of workforce planning, we really looked at what we see in public health practice, also the private sector on what the steps are for workforce planning. Also, we worked with our ASTHO performance improvement team to align with strategic planning cycle and strategic planning guide, because as we were talking about it, planning in the end is planning. And so hopefully these steps and these phases make sense to you all who've done organizational planning, strategic planning, or all kinds of planning. And we hope that these are relatable and approachable steps for you to take it to the next level. So I wanted to show you those phases. As I mentioned, as you get into the guide, each phase talks about steps that you might take in that phase, how they all build upon each other, and how you can go back and forth. You may already have a workforce plan, for example, where maybe you've set the priorities, and maybe there's an opportunity for you to even go back and look at organize and assess the environment. And we hope that that's helpful for you. So I'm going to turn it over to my colleague, Colleen, and she's going to be able to speak to the tools and facilitation guide that really follow those 5 phases and get into the nitty-gritty.
Thanks, AC. Hello, everyone. I'm here with my colleagues Celeste and Brandon as well, representing our UNMC team. Our office serves Nebraska. That's our focus, the public health practice community. And we are also a member of the Midwestern Public Health Training Center and, as Melissa mentioned, FIG TA provider for Region 7. We are a part of a group of people providing TA. Our office provides support to that public health practice community across Nebraska. We provide technical assistance and training on meeting the national standards and measures for public health departments. That pretty much summarizes all the things we cover. And upon request, we provide planning, facilitation, and coaching services to health departments and others. Next slide, Melissa. We have been really glad to collaborate with ASTHO and PHAB on the development of our workforce planning and facilitation guide, which started as a request from our public health system to create resources and tools beyond workforce competency assessments, which is mainly what we had done historically. one of our goals is always to build capacity for anybody that we're working with. So as we were thinking about what was being asked of us and what we were creating, we really wanted to create something that people could implement themselves. So our team, Brandon, Celeste, and our team lead, Katie, and I worked on creating this resource. I'll show you some of what's contained in it in a moment. But I want you to know that we are a team of facilitators and planners by training. And a couple of us have even been accreditation coordinators. And we bring all of that experience to the development of this resource. And we had review and input from health department staff and other experts. And we're grateful to all of those folks who contributed. At the beginning, we really took some time to review what was already available out there, which is how we happened upon AC and Melissa and their work. And others like the Montana Public Health Institute, which has a really great workforce planning guide tailored to small health departments, which we used as inspiration in our own development. Our resource offers a detailed planning approach that you can tailor to meet your needs and resources, depending on the funding available and the staff you have available to do workforce planning. It also includes background information and context, and includes questions you can use to support and guide the development of your planning approach. Next slide, please. The rest of these slides just show you what's contained within our resource. In this phase, the organized phase, we include many of those questions you can use to create a manageable planning process, things that will help guide you in the design of your approach. Next slide. In the assessment phase, we include lots of ideas for and links to different assessment tools and things to consider in your data collection approach. And we worked really hard to find content and resources for how to assess workforce capacity. In the past, we focused so much on workforce competency. It was a challenge and really interesting to explore how a health department might plan for recruitment, hiring and retention, role realignment, and future workforce needs. So we worked hard there. We hope that you find some interesting resources there when we release this. Next slide. This is the phase where you will find the facilitation guides, including sample meeting agendas, timeline of preparation activities. We got really detailed here for you, and steps for facilitating conversations. From reviewing data together to setting goals and outlining strategy, you will find implementation guides that you can either use in-house or you can hand off to a hired facilitator if that's the route that you choose. And all of this you can tailor to meet your needs and resources. Next slide. In this phase, we basically include a link to PHAB's workforce plan template, which Melissa will talk about in a moment. And we're glad to have that as a resource that really helps link everything to the accreditation standards and measures. Next slide. In this phase, we include our best tips for moving from setting priorities and making plans to actually implementing them. And I think that's the hardest part, is the implementation. It's easy to plan. It's harder to implement our plans. We believe that project and performance management are a lifestyle. And if there are any Nebraskans on this webinar, you'll remember me saying that over and over again. This is a way of being. Implementation is a way of being. And performance management, project management, it's about our behavior. And sometimes it requires behavioral changes. So We tried to include some of our favorite tools that we use ourselves and we offer to others when we work with people on implementation. And my last slide gives you a sense of some of the kinds of questions that we've included in the resource and some of the facilitation guides, what that looks like. It does get quite detailed. The guide is currently with our graphic designer, and we anticipate releasing this resource in January of 2025. And Melissa, I wonder if we could send the link out to registered folks on this list from this webinar when we're ready. I would work with you because I was thinking I could just encourage people to email me if they wanted access. And then I thought, I don't know how I'll keep track of that. So you can email me. My email address will be on the last slide, but Melissa, I'll talk with you later about how to distribute that to folks listening today. And with that, I am complete, and I'll turn it over to you, Melissa.
Great. Thank you, Colleen. And I just said in the chat, we absolutely can do that because we'll have the list of all the registrants and we can get that out to folks once it's available on the web. All right. I moved my window here, so I've got to move it back. Give me just a moment, please. So now I'm going to talk about the workforce plan template. But let me start just very quickly with a quick overview of PHAB. So this slide shows our mission, and while most of you know PHAB as the sole national provider for governmental public health departments, we also do a significant amount of work in the broad systems and services space. We are the stewards of the 10 essential public health services and foundational public health services models, and we have a variety of tools and resources to support public health transformation in that space. And as noted before, we are one of the 3 national technical assistance providers funded through FIG, and we continue to grow and expand our menu of training and technical assistance, consultation, facilitation services, both to support accreditation, but also broader foundational public health services and other systems improvement efforts as well. So I'm now going to share a little bit about what I'm calling a newer, in quotations, workforce template and user guide. And I say newer because the template has actually been around for a while, but it's recently been updated. And again, I think as Colleen noted, and possibly AC as well, this resource really is helpful to health departments when they're in that phase 4 of the workforce planning cycle. So I'll start with just a little bit of history. So the template, as I said, has been around for a little while. It was first developed in 2011 in Ohio in response to a request from local health departments across the state. Ohio is the only state in the country that mandates accreditation. And at the time, the Ohio State University College of Public Health Center for Public Health Practice was providing accreditation support services to the local health departments in Ohio, and they requested a template. And so they were very actively involved in the development of the template as well. So it's been around for a while. Stewardship of the template was actually transitioned to PHAB in late 2023, and they did that really for the purpose of ensuring that the template could remain up to date with the standards and measures for accreditation. And so this newer version aligns with version 2022 of the standards and measures for initial accreditation. And originally it was just a workforce development plan, so it focused just on that training component and development component, but it has been expanded and really takes that broader comprehensive view of workforce planning. So it is thinking about capacity, it is thinking about capability, training, development, recruitment, retention, all those broader elements that we've been talking about throughout the webinar. So this slide shows the table of contents page. I know it's a little small, but I think Lydia, if she hasn't already, will pop the link to the template into the chat. But again, this shows the table of contents page. It includes, again, sections that address capacity, recruitment and hiring, training and development, employee satisfaction, employee well-being. It includes workforce plan objectives and strategies, implementation plans, monitoring. Again, you'll start to see the themes across the workforce planning cycle and what's actually contained in the template as well. So it is a Word document. So when you pull it off the website, it's in Word format. It can be edited and includes guidance and instructions for the type of content that can be included or should be included in the different sections and subsections. So there's some guidance and instructions there. There are also accreditation related references. So if a section speaks to a specific documentation requirement or one of the standards or measures, we've tried to note that throughout the template. And then there's also an accompanying user guide and resource manual. So I will say, as AC mentioned earlier too, along with the workforce guide and of course, the facilitator guide from University of Nebraska Medical Center, irrespective of your intent to apply for accreditation or reaccreditation, which of course we all hope you consider, this template can be helpful. And it really is intended to be just that, a template. So you take the pieces and parts that speak to you, that speak to your department, that speak to your agency, and you use that. And if something doesn't apply to you, then it can be deleted. But it really is to just give departments a good starting point. And again, for those that are interested in accreditation or reaccreditation, starts to create that alignment around some of those documentation requirements related to Domain 8. So I mentioned the accompanying user guide and resource manual. And so this slide shows a screenshot of one of the pages. Again, it's really small, but it includes guidance for editing the template. So how do you approach editing that Word document? It also includes a variety of resources that are organized by the template section. So you'll see here, this is the plan section, capacity, recruitment and hiring. And so then all the resources and links that you see there are related to capacity, recruitment, and hiring. There's also within the user guide a supplemental checklist that includes workforce-related standards and measures for initial accreditation. So you can kind of be checking off those boxes as you're writing your plan to make sure you've met or addressed those documentation requirements. And then there's also a template for a training plan. The user guide also includes contact information if you have questions, or we are open to suggestions for improvement. If you have other resources that you think would be helpful to others and you think we should include in the resource manual, just reach out to us and we'll consider all of those inputs. So that's at a high level, an overview of the plan template and a summary really of all the three tools, the guide, the facilitator supports, and then the template. So I'm going to pause here and actually check the chat for any questions. I don't have a really good view, so I'm going to, yeah, thanks Lydia for reminding folks. If you have a question, pop it here in the chat. We've got plenty of time here. So does the guide include the resource manual? I assume that you're referring, well, can you say a little bit more, I guess? I believe it's Toika. I'm sorry if I'm not pronouncing that correctly. Okay, so AC, the ASTHO guide, the workforce planning guide from ASTHO does include the link to the PHAB's workforce template. Does that answer your question? If not, just please, you were wondering if it was one guide. I'm still not sure I'm clear. I'm sorry. You could clarify a little bit more.
I can say a little more, Melissa, just guessing at the question.
Okay, sure.
In the guide that we're creating, we have links to a lot of different
Mm.
resources. And that includes the PHAB template. And ours will be PDFs, but it will be located on a learning management system where people can click into different parts of it as needed.
Thanks, Colleen. And I'll say too, as AC and I were talking about the workforce planning guide and the template, there is some redundancies, and there's redundancies too with the University of Nebraska tool as well. And there could be opportunities in the future to streamline that a little bit. But for now, the resources are located across all three resources, because again, I think they can be used in conjunction with each other, or they can be used independently. Oh, Maya, thank you. CDC types of evaluation on page 25 link opens the CDC sexually transmitted infections website page. Well, that was not the intention. So we'll double check that. Thank you. Oh, okay, okay. So the user guide and resource manual for the template are located on the PHAB website. And I think Lydia may have put that link in the chat. If not, Lydia, could you do that? Thank you. Thank you. There's the link to the user guide for the workforce plan template. Sorry about that. I know it took a little bit for me to understand what you were asking. Thanks for your patience.
Melissa, there's another question about the PHWIN survey. It says, does the PHWIN survey capture a comprehensive assessment of the staff, or should we also ask staff to complete the other surveys listed on one of the slides shown earlier?
So I think that's really up to each organization. I would look at the Public Health Wins survey and see if it meets your needs in terms of content. I will say, if you're thinking about accreditation, we do consider the Public Health Wins survey to be meet the requirement related to a competency assessment. So I will note that. But I think we're providing a variety of tools so that you can select what speaks to you and your agency and speaks to your needs. But I'll pause and see if Colleen or AC have anything to add.
I see Susan in the chat adding in too, that they're doing an engagement survey in addition to PHWINs. I think there's so much opportunity to ask the workforce questions and to help guide your planning and discover what gaps or opportunities there are in terms of workforce planning. So PHWINs is an excellent start. And there are a ton of resources out there that you could consider. And I always say to our health departments, try something one time, and then when you go to update it, see if you want to add on and do some quality improvements to your existing experience. AC, any additions?
Yeah, I agree with what you both said. I was also going to add, I know you're mentioning PHWINs in the chat, but not all jurisdictions, participated for different reasons at PHWINs or feel like they have a sufficient sample size so there's something to think about that. I agree PHWINs is a great source of data. It's so exciting now that so many local health departments are now part of PHWINs, and we're going to be able to look at data comparatively regionally, locally, state, and there's actually moved to have island participation in 2025, which is also really exciting. I think what I've heard from some jurisdictions is sometimes it doesn't drill down enough, or they want to be able to ask, more program specific or organizational specific questions that you may be able to drill down a little bit better. The only other thing I would add is that we've spent a lot of time talking with jurisdictions about how you promote or market or engage to your, with your staff to say, okay, I filled out PH wins. Why should I also fill out another assessment? What feels like another assessment at my organizational level? And I think that comes down to really communicating and being transparent about, what PH wins looks at and what your workforce assessment looks at and how you're really going to use that data in your organization.
Yeah, thank you both. So I see a question from Tiffany. So the assessment that was used by Ohio State is no longer available. So I think you might be referring to a competency assessment. Yeah, the Ohio State unfortunately no longer has the funding that they did to keep some of those tools and resources updated, which is part of the reason why the template, stewardship of the template was transferred to PHAB. So that assessment, I don't believe exists any longer. However, we have the Public Health Wins, which we've already spoken about. The Public Health Foundation also has an assessment tool that's aligned with the public health core competencies. And I know there's some other assessment tools that are listed within the user guide and resource manual as well. I don't have it open in front of me, but Colleen or AC, if you've got anything else off the top of your head from a competency assessment standpoint, not to put you on the spot, but something front of mind, please share.
I was trying to remember in our research as we were looking at other resources, I was thinking that the Public Health Training Center Network,
Mm.
part of their charge is to support the workforce across public health workforce across the nation, and many of those organizations are have options available or could support you. And I was just trying to find the website, which I can put into the chat as another resource.
Yeah, great. Thank you. That's silly. I worked with the PHTC network for years and that didn't even, I know sometimes they'll do assessments as a region as well.
Yeah.
So Maya, is there any dialogue about organizational justice in these resources?
I love that question, Maya. And I know Maya. So I feel like I'm gonna call you later, Maya, and have a conversation with you about what you mean by that and how we could incorporate it, because it sounds like it would be a great addition to a planning tool. So not right now. And oh, thank you, Maya. Not right now, but I would definitely be happy to talk with you about that. And I also want to say, um, we would love your feedback if you use our guide when it comes out in January. If you use it and you're like, "Ooh, this would be a great addition," or "This link doesn't work," or whatever you find, we will include our contact information. We want to make it better, and there's no better way to make improvements than to hear from people who are using it. So this is great. Maya, I'll call you later.
I love that. Um, Tiffany, you just asked a question that you've replicated that old OSU assessment. Is it something we should let go of and use other assessments instead, or even just public health wins? And again, Tiffany, I think that's really a decision that you need to make based on your organizational needs. And I see my fellow presenters shaking their head yes as well. I mean, there are a multitude of tools that are out there. And so I would just say select the one or ones that work best for you. And if you've adjusted the old OSU assessment to meet current needs and that's working for you, then continue to use it. Look at the public health wins. If that gives you something that you don't have and need, then you can consider public health wins. We don't recommend any specific assessment tool. It's really, we're providing you with options and then you can choose what works best for your organization.
Yeah, I completely agree, Melissa. And I would also add, sometimes jurisdictions are really thinking about how to compare data from one assessment to another. So sometimes there's reason to use some of the same questions or the same tool that you've used in the past that may or may not apply depending on where you're at. Or maybe that's so outdated, we want to do something new. So those are things to think about. And I think, this won't surprise any of you probably on the call, but we talked to a lot of folks around survey fatigue and assessment fatigue and trying to balance that with where your workforce is at. Can you do a mini assessment where it's just, asking very specific questions that you feel like you didn't ask before or didn't get drilled down enough in PHWin? So I think there's different ways of approaching it while getting some really actionable data. I think we spend a lot of time talking with jurisdictions also about that, is that sometimes we want to ask everything in the kitchen sink, and that has its value. At the same time, are your questions or what you're asking about, are they actionable? Are you going to get enough data to do something with it, to inform your workforce plan, to inform your leadership about where you're going next?
Yeah, thank you. So there's a question here from Mira. Does the guide mention anything about customer satisfaction surveys? So I can speak for the template. It's not noted in the workforce plan template. I will say, this is a shameless plug, that we're working on a performance management QI template, which will be released soon. And we do talk about customer satisfaction survey data in that template. But I'll pause, and Colleen or AC, I'm not sure if in your resources, customer satisfaction is noted.
Yes. Well, now I can't remember. I was thinking about employee well-being and thinking about employees as customers when I read that question the first time. So there's
Oh,
definitely employee well-being and employee satisfaction
oh, right.
questions and a section in our guide, but customer satisfaction as to external customers, I don't think we've included that.
Uh-oh. So my chat's going now, so I want to make sure I don't miss anything. That's good. I love this. Um,
I see
oh,
some comments about strategic planning and strategic planning guides. We have thought on our team about translating our workforce planning guide into a strategic planning guide or just a general planning guide, because the steps are very much the same. Of course, we wouldn't be surveying around workforce competency and capacity probably in a strategic plan, but it would be included in a strategic planning process. So we have thought about creating a set of facilitation guides. It'd probably be a pretty easy shift. So I think it's a great idea to have some resources on strategic planning. AC, Melissa, do you have other resources for that?
yeah, so I'll just mention real quickly that a strategic plan template, because this is quick, is on the list for us to develop as part of our FIG Year 2 proactive TA work, and would love to do that. Again, I see work for ourselves in the future, ladies, coordinated work around this too, because I know ASTHO has a strategic planning guide already. So I'll turn it over to you, AC.
Yes, thanks, Melissa. I'm putting some links in the chat to some of our resources on planning and organizational and strategic planning that I hope will help to you. And I think, yes, they're written, for state and territorials, but I think that there's a lot of adaptation for other jurisdictions as well.
So I just put in the chat, I lost the question too. So AC, thank you for that. And we can talk too, Colleen, if you're thinking about facilitation guide, maybe
We should talk.
job security, right? We should talk for sure.
We've got lots of
Um,
ideas.
I know, lots of ideas in so little time, right? But someone asked about when the PMQI template would be released, and we're hoping to have it launched by the end of the month. So, and we should put some promo out about that as well. And AC, I believe ASTHO also has a PMQI planning guide. It might be under revision right now, but you're starting to see a theme in terms of how this work is being packaged. Tiffany, will there be a thread of alignment through these various guides to simplify that understanding? We can think about that as we're developing. I think I understand what you're saying. And so we can think about how to promote, how to share in a way that shows the connection. I think what you'll find is that, what AC was saying earlier, that the planning cycle that's used like for the workforce planning guide is really a strategic planning cycle that can be applied to planning around QI, that can be applied to strategic planning, that can be applied to workforce planning. So for me, that's one common thread already that's running across these resources. Oh, someone meant like a crosswalk. Something to consider. Thank you. Nikki, let's say, how will it be shared? So I think all of our agencies share things in different ways. I know social media, I don't know how many of you, if you're FIG funded or a FIG, you receive pass-through funds, there is a FIG website, and we often post these new resources on the FIG website. But I would say watch social media as well. We do a lot on our social media channels. I know a lot of our accreditation specialists have been talking to health departments that are looking at accreditation or reaccreditation. They're keeping lists of health departments that are interested as well. So we'll get things out through our accreditation specialist as well if you have one assigned to your health department. All right, any other questions? This has been great. Let's see. So will the PMQI guide also have the local public health lens, like the strategic planning link that was just posted? I think that might be AC more for you.
That is a really great question. And I don't know the answer right now. I've just reached out to our performance improvement team to kind of get a sense of when and what. So once we know more, I can share that.
Great. Thanks, AC. All right. Last call for any questions. Otherwise, we'll start to wrap up. Oh, thanks, Stephanie. This chat's been really helpful because hopefully you have found it helpful that we're able to answer some of your questions, but it's giving us some ideas too for how we can make improvements. And, the work's never done. That's what I always say. We put a template out there, but it's always organic and a work in progress. So, and I'll mention that again. I think with any of these tools, all three of our organizations, if you have suggestions for ways to make it better or more useful in the field, to just please let us know. And we'll take those considerations, to mind as we're making updates.
I totally agree, Melissa, and I couldn't be more excited to collaborate with you all and these partners and those that advised and reviewed all of our products from different backgrounds. And I think this is kind of the first time we've done something like this. And so it can only get better from here. So your feedback and input's really important. And I was just also thinking about some of the questions and some of the things we've been talking about. And sometimes I can remind myself and remind others, and I have written my own workforce development plan for my own public health agency. And sometimes you want to do everything, and just like, it's okay. It's okay to do what you can, to do what's realistic, to do what's most important. Just because we have these great tools and suggestions and best practices doesn't mean you have to do it all. I mean, I can't defer to PHAB on what's required, but I mean, I'm not gonna speak to that, but I mean, in general, just, it's okay. Just assessing your work, not just, but assessing your workforce, telling your workforce it's important that you care about them, that you care about their needs, and that you're trying to make a difference, and that you're part of that. That's huge. And that's us moving us all in the right direction, I think. That's my little soapbox. I can get off now.
No, that's good. It makes me think of the first you crawl, then you walk, then you run. And my experience in working with health departments and having worked in a health department myself and written plans like AC mentioned. Yeah, there is no such thing as a perfect plan. That is true. And there's analysis paralysis, which happens sometimes too. But I have seen departments, and myself included, where we like wait until we feel like we have to have all the right data. And it's like that, don't let that slow you down. Crawl, walk, run. And in the wise words of a local health commissioner in Ohio, he's like, really, Melissa, sometimes you just kind of lay around on the floor and roll around a little bit before you even crawl. And I said, you're absolutely right. So don't let perfect be the enemy of the good. Start to write a plan based on what you have. And if you feel like you're missing something, pop it into your goals and objectives so it doesn't get lost. That's a great place to capture those things that you don't want to lose sight of, but you need. Just don't let perfect be the enemy of the good. All right. Okay, contact info. I'm going to get to that in just a second. AC, that's yours. Okay, Kirsha, just real quickly, I want to address this question and then we'll start to close out. For accreditation, it would be really nice to get help on facilitation, especially when we're not only compiling docs, but also leading the teams in writing the plans. Okay, and I think that's where, if I'm reading this correctly, the guide that Nebraska has created is super helpful because it has some very specific facilitations, tools, and resources for the person who's facilitating their in-house teams.
That's true, Melissa. We hope that you can just grab it and add a few of your own notes, but basically do what's said there. So we hope that functions in that way, but we'll take your feedback if it doesn't and make improvements.
Yep. Yep. Fantastic. Okay, I'm going to start to close us out. If you think of a burning question, pop it in the chat. We can answer via the chat. Or leave a little bit of, if we have a couple minutes or so at the end to address it. So here are the resources and contacts. So you'll see for each of the resources or tools that we talked about today is the link, with the exception of the facilitator related guide. That anticipated launch is January, and we'll make sure we send a subsequent email when that's ready to all of you, so that you get the link directly. And then you'll see the contact information for AC, Colleen, and myself. So please do not hesitate to reach out if you have questions. And then last but not least, thank you so very much for attending. I also want to thank Colleen and AC, two really amazing colleagues, Lydia for all her help on the tech side with this, Brandon and Celeste, also with the University of Nebraska Medical Center, who were part of the planning and helped develop the tools and resources that we were able to share with you today. So thank you to everyone, and thank you to all of you for being here as well. We do have a very short evaluation, and would love it if you'd take the 2 minutes that's left to click on the link and give us a little bit of feedback. There is a question in there about whether or not you would all be interested in a possible deeper dive training or workshop around workforce planning. That's something that we're considering if there's interest, and we would leverage these tools for that purpose. So that's a place in the evaluation where you can give us some indication if that's an interest or not. So with that, I think I'm going to go back to the slide in case you want contact information. But I think that's it. AC or Colleen, any final words?
Just
Oh,
thanks
the
to
link. I'm sorry. Oh, there you go, Lydia. Thank you. Sorry, Colleen.
No, that's okay. Thanks, Melissa and AC. It's been fun to work with you. And thanks to all of you who are listening for all the work you're doing to support the public health workforce. It takes all of us, and I appreciate your work.
Thanks, everyone.
Yeah, same. Thank you all. Have a lovely rest of your day, and thanks for joining.